terms of the opportunities for immigrants, and we thought, how can we do things differently for immigrants and other people who are facing similar challenges? There could be people with disabilities or even some of the local residents who face challenges. So I think that's how we enter into economic development sector through Human Endeavour. So EPIC is Enterprise Promotion and Innovation Center. That's actually a physical center under Human Endeavour, which is our social enterprising incubator in the city of Vaughan, Ontario. And basically what EPIC does is it helps individual or it helps organization. Individuals are helped with training, income opportunities or placements, or establishing business or social enterprises, and there could be anyone from the community. And we also have a replicable model of our economic development social enterprising incubator that other organizations can take it from us, and then of course through under a franchising agreement we replicate, and that's how they generate income and start economic activities in their area. And we have done one setup in a rural area, which is Georgina in York region where we are located. So we have 5 social enterprises under Human Endeavour, which is one is multimedia, one is technology, one is health, one provides training to different organizations or individuals, and we do also event management. And today the focus of technology and health is what I'm presenting. And then there are 2 other two other social enterprise at our franchised location in the rural. They have their own focus of developing the services for the community. So I think just want to give you a little bit of background that when we say economic development, what we have done in the last 5 years so that you can put things in perspective, and then whatever we are doing moving forward, you can at least have a sense that how it might work for us. So we just start generating our first product in late 2010 and 11. So the first year we generated around $6,000 in revenue from some of the products. Then in the next year it became $80,000, and then currently we are here around $185,000 in revenue, and then around 25% is our profit margin. And our target currently is to get sustainability. This does not include the products that I'm going to talk about. This is just the other products that are currently in our development, or we develop and we sell. And this revenue basically will sustain this particular project, and then of course the healthcare products are add-on. So currently in the first 2 quarters we have our revenue of around $140,000, and then this goes in with this target, and these targets are set by Ontario Trillium Foundation to make our project sustainable in 3 years, and I think we are on track for that. So I think it just shows you a continuous growth of social enterprising strategy through our organization, and then that we feel is going to accelerate in the coming years. Okay, so paper is focusing on social economy and its true broader impact that we think is not yet understood. And that's my feeling, and I think a lot of the colleagues who are working at Human Endeavour, that since a lot of these social enterprising individuals, they are from the social services, I think again, this is my perspective, you have to agree or you can disagree with me, that the scope of the products that they normally generate through their social enterprises, it's very limited. And I think that's, maybe I have captured it later, but I think one of the reasons is that as social economy sector, we have not been able to make our mark. And there are many reasons for that. And I think one of the main reasons I believe is that focus is around individual organizations or the communities that they serve, the small community groups, or the local sector, local needs. They have not thought about large-scale projects or large-scale products that can go internationally or at the country level. And that's what's keeping the social economy impact sort of contained or in the communities, local communities as well. So how can we expand the scope of social economy? That was one aspect of the paper. And I think that in generally, I would say that it's how we envision, think, and operate social enterprises. That will be. And I think whatever nonprofit social enterprises do it has to be that they have to go beyond their organization. And how they can go beyond their organization is innovative and expanded collaborations. That will be one aspect of things, and how they implement things. So we have taken a very broad approach in terms of what social enterprises are. For us, we go beyond the traditional definition of nonprofit only model. We actually involve for-profit entities with us who work with us, and I think I forgot exactly the presentation, but somebody talked about how a collaboration of various entities can come into picture to create a broader impact. That's exactly what we are doing in most of our products. And then franchising model is another application, how we can enhance the impact of social enterprising. It doesn't have to stay with human endeavor only. If we have done something good and other people can take advantage, we have made it available to them to do it. And then, of course, the focus on collective impact should be there, not just the impact on your clients or the local population that you serve. And then I think the other focus that I will be just sharing with you is that we have to seek solution to the visible and significant challenges. I'm not sure how many people know Group Convex. That's Prescott Russell, an organization. That is actually the first social enterprising organization that I visited when we started this initiative. And certainly they think beyond what the local sector needs are. So recycling work that they are doing, I think that's a very good example. And in our case, I think we are focusing on graceful aging, settlement of newcomer, and poverty reduction through our social enterprises. And none of our, I think, products are focused on just the communities that we serve. They are pretty much ready to be bought by anybody around the world, and that's how currently we are doing it. And a number of people have bought our products. But again, yes, definitely we are focusing our own clientele first that we are serving, and then our products are being sold. Technically, anybody can buy those for the benefit of their own communities. So I think it will be, yes, there are a number of people or social enterprises who work at a small or medium level, so that has to be done. But it will be a mix of small, medium, and large-scale scope projects that will expand the scope of social enterprising. It can't just happen with large projects, because then you may end up missing the small community-based initiatives that are needed. But just alone, one particular thing is not going to create the value that is needed at this point for social economy. So how can we impact the broader economy? I think I see, based on my 5 years of experience in social enterprising, one thing that I see is that we call the third sector, it's kind of isolated from the main economy or the mainstream economy. Regardless, you talk about statistics, you talk about revenue, you talk about job creation, there's very little information that's available for social economy sector. Recently, some work has started in this area, and people are doing it. But I think if you have to come to that area where people start comparing you with the mainstream, you have to produce, you have to work on projects, or you have to work on statistics and anything else like a mainstream economy, and only then people will recognize you. Second, I think there's a lot of focus still on social economy as sort of a government-supported entity somehow, and that's needed. Yes, I think at the beginning, maybe that's pretty much necessary, and I can say this from even our own perspective, that yes, we got funded. Yeah, but our main focus has always been how we sustain ourselves, because that is ultimately how you can stand if your products are independently, they are produced independently, and then of course they generate enough revenue to sustain. So innovation and cost-effective solution to significant challenges faced by the society and government, that is really how I will give an example of the product today. We feel that if we start focusing on as a social economy, and there's a reason why we are saying significant social challenges or economic challenges that as a country or as society we are facing, because only then you will have a favorable view from the investors or from other people if you stay focused, small or local, then may not be, those initiatives might be very good locally, but people will not realize their actual value. And then develop products and services for high value, high impact, and that's what really the example that I'm showing you. These statistics just show a little bit of the aging population in Canada and potentially what kind of healthcare cost they eventually will be utilizing by 2031. So currently, we account for around 40 to 50% of the provincial and territorial healthcare spending because seniors have chronic diseases and many other healthcare. And then if nothing is done, a study shows that this will be 60% by 2031. And that is really what our product is focusing on. I think innovative social business possibilities to keep seniors healthy in their own home and avoid hospital admissions, that's really what our focus is. And I think by doing that kind of research and generating products for this sector, we believe we can create the market for social enterprises where people are not looking at government-sponsored projects, but it's also an independent thing where they will recognize the value of the sector. Since I'm working with my colleagues in USA, so there are some numbers here from USA as well. So currently, USA in America, they spend around $3.2 trillion, and 71% of this spending is associated with people who have chronic illnesses. So heart and stroke and diabetes and many other cholesterol-related things, they're all comes in this category. So taking care of aging population and people with chronic diseases in a cost-effective manner, where compassionate care of patients and sustaining of healthcare system are the priorities. I believe this fits well with what social economy purpose is. It's not about to make money, it's about a combination of both of those things. And that's where our center is focusing at this point on developing innovative telecare and telehealth products. One of the products that I'm sharing is called Remote Patient Monitoring Kit. What it does is you can install certain sensors in a senior home or a person who has certain illnesses, and they will continuously track the health of that individual automatically, or he has to do certain test by himself, upload it to a certain center where software is automatically looking at, and if they see something that's abnormal, they will trigger a certain alarm or a certain sensor to, let's say, a nursing individual or a PSW who can intervene ahead of time. If this is unchecked, then 2 or 3 days later, that person has to go to hospital, which we want to avoid. So I think these are low-cost interventions way ahead of time that can be detected, and there are lots of studies that shows that that's how it happens. And there is a recent study that's released by PricewaterhouseCoopers that estimates that in Europe is way ahead in remote patient monitoring or other digital healthcare solutions, that it can save up to 35% of treatment of chronic medical conditions. And if you take this 35%, it's $700 billion saving in US alone. And if you take Canada's $200 billion investment, you are talking about a significant $70 billion saving to Canada that potentially can happen if it's implemented correctly. So we did a demo of this product in April in Ontario. Kent State University does a lot of volunteer work, so they are setting up some centers in Haiti where they go and do volunteer work. Yeah. And that's some of our test sites, and we are looking also some test sites here in local hospitals. So how we entered into this field, I'm just going to go quickly just to give you a perspective. We started a project for seniors preventive health engagement. These are regular community-based wellness projects in a community center, and we serve around 700 seniors. So that seniors and looking at health and wellness and aging issues gave us certain ideas what to do for these seniors or other seniors. From our economic development, we picked up the value of social enterprising, which is economic and social return. We have a lot of immigrants who come to Canada, especially in Toronto area, who are looking some opportunity. So we don't have a lot of cash to give out at the beginning, but though this particular product is being developed by 2 engineers working with us. And so we are using them, and while they are working with us, we do give them certain portion of income from other products that we are selling. And that's how we entered into telehealth market. And now for verification, we are working with our partners in US and some of the local ones. The way product looks like is you have a tablet. They can have oximeter, glucometer, blood pressure, digital scale, thermometer, or motion detector. So motion, where we can monitor somebody's, so these are the tests that they have to do, but motion detector might be just to check how many times somebody is going to washroom, how many times the fridge was opened or not, or those kind of conditions, because we can determine the health of an individual from some of the physical activities as well. And then all the data continuously is being transmitted to a central data. This is currently available and is being tested in our health centers. And in a bigger picture, what it looks like is we have this kit, and then their home can be also censored with certain, so this is more checking if the bed is wet, for example, or something else. Automatic signals are generated, data goes to central database, and then profiling and software does all the alerts here, or a nurse in a low-cost nurse can be in a health center monitoring the activities or looking at what's wrong, and then either automatic signal can be generated or a nurse can assist with some others. So that's how you are avoiding the hospital admissions or deterioration of chronic diseases in those patients. We have partnered with, again, Human Endeavour Incubator, which is a non-profit. Community at large is pretty open for us to test these products with their health, with them, so we don't have barriers into getting data with some. City and region are helping in sometimes financially, sometimes giving us certain in-kind aspects of it. Infinium is a private, for-profit, but socially responsible entity that is set up by 2 of the immigrant engineers who are actually developing these products with us, and of course, they or other newcomers. Kent State has been, it's surprising, but Kent State, even though it's out of Canada, they have been our biggest partner in terms of implementing this thing and testing, and they actually also see a new role of nurses. That's how they are more integrated with us, that this whole creates a whole new field for advanced care by nurses or other professionals who are below nurses, and that's a new market for them, and that's how they see their new role in reducing or sustaining the healthcare system, and of course our funders. So I think we have, based on this, we have 4 recommendations for the social enterprising sector. One is that high value, high impact innovations are needed so that people can see that it's not just local small projects. They can work on as social entrepreneurs, we can work on some very significant projects like this one, which has a countrywide or continent-wide impact on that. Then the broad-based collaboration, the way we are working with for-profit, we are working with the region, we are working with funders, we are working with universities, that kind of environment is needed, and everyone has to benefit. There should be some incentives for everyone in this to succeed, and definitely if your business is socially responsible, generating income, that can be shared, as long as I think as non-profit or social entrepreneurs, you are driving how things should be done. Yeah. We should benefit from it, or the community as a whole should benefit from it. Role of universities in rural areas, that's what Kent State see as an economic driver that can not only create, but they are looking at how some of these products can be integrated or developed in their own area rather than in Canada only. So I think that is another incentive for them to work with us. And I think the last is that social enterprises based on blended return are the best entities to tackle large socioeconomic solutions. So I have shared with you a healthcare problem that is creating economic opportunities for people who have challenges in finding jobs. So I think there's no better entity than a social enterprise to tackle those challenges. That's what we feel, and that's what we have done, and I'm sure other people can follow the same. Thank you.
Thank you very much, Noor. So as we mentioned, or I don't think we mentioned, I mentioned to the presenters, we'll take a few clarifying questions, but if we save a bigger discussion until all three of our presenters are finished. But if anyone has a quick clarifying question for Noor, we'll certainly entertain one or two. Apparently you spoke very clearly. So.
All right.
Okay, thank you very much.
Thanks a lot.
So next up, do you need
Nope.
And re-mic the next person, Doug, so I just need a little change over time.
Oh, okay. Carol, is your slide up on this?
Yes, it's in the folder. And my the elder care. Shannon School. Oh, do you want to do that? Well, you're going to put that on your belt. Or just put it in my pocket. In the pocket, okay. And, oh, sorry. Just going to put that right on the coat there. There you go. You got it? Or you want me to?
You got it up?
Oh, excellent. I do.
So our next presenter is Carol Murray, who's coming to us from British Columbia. She's the Executive Director of the British Columbia Co-operative Association. And she's going to be speaking to us regarding seniors, elder care. So thank you, Carol.
Oh, thank you, Doug. Yeah, appreciate it. Hello, everyone. It's a pleasure to be here this afternoon. This is such an interesting and fabulous conference, partly because it's so eclectic. And I was commenting at lunch also that there's quite a range of age and good representation of both male and female. So, so it's interesting that you know, you get that kind of turnout, and I understand that it's sold out. So that's fantastic too. So, yeah, yeah. Hang on. I'm like Mike Lewis, right? Yeah. Oh, look, there we go. All right. So this is my mother, Flo Murray, and at 93, she's one of the youngest in the family, of her family. Her two older sisters died at 96 and 98, and her mother died at 101. So Mom is now in a what I guess we would call a retirement home, for which she pays over $5,000 a month. Yes, I know. And yeah, and she's nearly blind. She depends on the day, you know, and the story kind of changes. And she's confined to a wheelchair. I don't know if you can see in the background the wheelchair. Pretty much. Her knees are quite bad. However, she can transfer from the wheelchair to another chair and from that to the bed and so on. As soon as she can't do that, and it's incredibly painful, just incredibly painful, arthritis in her knees. And as soon as she cannot do that, she will be in what's called housing crisis, which means that they must find housing for her somewhere within the province of Ontario. She's currently in London, Ontario. She could end up in, you know, Kenora. Far from my sister, who's living in Oakville. You're allowed 5 preferred, you know, on the list, and but of course everyone's going to have pretty much the same 5. Her chances of getting into those apparently are quite slim. So Mom's, you know, teetering on the brink. My sister and I have long conversations around varying, you know, subjects, but inevitably it's what are we going to do about Mom, you know. Full faculties, mentally alert, she can tell you, you know, she's got it all, and yet, you know, on the brink of housing crisis, and we may end up hundreds of miles away. So that kind of encapsulates, you know, what we're looking at in terms of elder care, and what are we going to do about it, and how are we going to do it. So this gives you a sense, these are statistics from the employment, they change their name all the time, Employment and Social Development Canada website. You can see, you know, as Noor was pointing out, you know, the population is aging. It's aging by quite a lot. When, you know, I was first at university, you hardly, you know, elders weren't really, you know, you didn't really notice. And now, look where we are, and look where we're heading. So yeah. And by region, you can see Atlantic Canada in 2011 with the purple there, you know, standing out, and then we'll continue to have the preponderance of elders as seniors. So, a report done by the Atlantic Seniors Housing Research Alliance called Seniors Housing Challenges, Issues, and Possible Solutions for Atlantic Canada. It's really helpful in framing out, you know, what are the issues that we're all experiencing, including my mom, Flo. So seniors want to age at home. They are not thinking about housing alternatives, et cetera, et cetera. Seniors-only housing, which is an interesting one, because my staff, who there's hardly, I don't think they're over 30, they all say, oh, wouldn't it be great? You know, we can have you know, young and old and so on. But this study is finding seniors-only housing. So that's very interesting. So, and home repair needs. So, disproportionate amount of their income. You heard about my mother and how much she spends. Oh, by the way, and if she wants to be wheeled down to the dining room for dinner, $5. Yeah, so mom tends not to go out of her room because she's, oh, it would cost me $5. Now, mind you, that's a return trip, so, you know, but, yeah. Social support, she's becoming increasingly isolated. Her whole range of you know, stimulus and so on is within her head and phone calls to us. And then, yeah, so that's, and her caregivers, which she says, they treat us like we're children, as if we don't know anything. So, yeah, so it's very interesting. So here are some solutions. Lifetime housing, home supports, continuum of housing choices, and community capacity building. And we would add in the co-op sector empowerment of seniors to make their own decisions, to not be treated like children. This is increasingly one of my own personal fears, and you can hear my voice rising. So in 2008, we did a national task force report. This was across the co-op sector in Canada, and put out a report on various recommendations. One was, let's research housing co-op models and find out what works and what doesn't. So we have an elder care program, 3 years at the BC Co-op Association. It's a national project funded by, Social Development Partnership Program and the Vancouver Foundation. And the idea was, let's try out some of these models. Let's see how they work, what doesn't work. We can get some best practices and then replicate those and using the co-op model. So is everyone familiar with the co-op model? Democratizing ownership, essentially. It's an enterprise model, so it's a way, as I say, of empowering seniors to make their own decisions, their own choices about what kind of housing do they want and how do they want it run. So, right, so here are the goals of the project. Essentially, we want to build community. We want to make sure that seniors have choice in their housing and are democratically involved, as I say, in setting priorities and decision making. So we set out to do that. We worked through my counterpart at the BC Co-op Association. We have provincial associations across the country, and we have 5.5 provinces, I'd say, or perhaps Nova Scotia. We're waiting to hear on whether we can find a project here. So in addition to BC, Alberta, Saskatchewan, New Brunswick, Newfoundland, and perhaps Nova Scotia. So 3 models we are testing. One was the full-service residential co-op, care co-op, which is, you know, provides assisted living, full assisted living in addition to residential care, and unfortunately, no takers. This is an area of lots of regulatory snafus and challenges, and so, you know, yeah, and very difficult to fund, very difficult to manage, and so on and so forth, lots of regulatory. So, you know, so unfortunately we won't be able to test out this model. However, we do have full-on co-op housing with some supports attached to it. So essentially very similar to what my mother is in now, hopefully not 5,000 plus a month. And we've also been looking a little bit at life lease options. Essentially you pay a lump sum up front, you have housing for your lifetime, and it allows the project to get up off the ground. It's, again, it's a tricky one because not all provinces, in fact, we've been told in BC, well, we don't have any policy against it, but essentially don't do it. So, you know, it's difficult to get going. I think it's mostly west of Quebec. Manitoba is the only province with actual life lease legislation, but most provinces don't have that. So here's some examples. So Calgary, I just got some notes here. So what's interesting about this project is the core organizers have quite a varied background. Some are architects, some are community organizers, and so on. Invariably, these are seniors that are coming together to organize these. One of the criteria for the program from HRSDC was that seniors need to be primarily or almost 100% owners of the co-op. So it can't be others, you know, in a sort of charitable model, others doing it for the seniors. It's the seniors themselves doing it for themselves. So, so they're focusing on a scalable model and providing housing to co-op members. The homes will be renovated into separate individual living spaces with common social and eating spaces. The co-op will contact a service provider, such as a public health nurse or a caterer, to provide some basic level of supports to the members that need it. So very similar to the situation my mother's living in. So this next one is in Saskatoon, gorgeous city. We were just there for our annual National Congress. It's stunning paths along the river. So they're building as you can see, in collaboration with the community health clinic. So the clinic will be on the ground floor of the building, so that's easy access. I know my mother, every second week the doctor comes. So, you know, yeah. So this would be great. They do have a nurse on staff, overworked, I'm sure, and but this would allow, you know, direct access to nursing right within the building. So that's fantastic. So Green Cove, Miramichi, Wendy Keats has been involved at the back there, been involved with this project through the New Brunswick Co-op Council. And what I like about this project is it really addresses that triple bottom line perspective. So there's a piece of land, they want to protect it, and they also want to cater to the needs of seniors. Why not pull the two together, protect the land while giving seniors a space to meet their needs as well. So small, affordable housing, perhaps sort of cabins, perhaps some shared spaces. They're still working on that model to suss out what that's going to look like at the end. Yeah. So thank you. So it's Miramichi, Clarenville. This was kind of a surprise to me because it seemed, you know, how could a small community support a full-on housing co-op? However, they have partnered, will be partnering, and they've been working through the Clarenville area Consumers Co-op and partnering with the Lions and the Legion in the area. So a really great model of partnership coming together. They also this is a little bit of an aging in place concept because rather than going to Gander or St. John's to a 4-hour drive, they want people to stay in Clarenville. You know, this is really important. I know my mother, you know, where's she going to go? Where's her community? Whereas if you can stay in your community, you've got those supports already in place. You don't have to be looking for them, right? So aging in place, really interesting concept. I refer to it for myself anyway, dying with my boots on. I want to be right in my, you know, my space. And so if there are ways in which to do that. One is through a foster care model. This has been tested in a few places. We're testing it here, where if you need to, for example, be hospitalized for any length of time or in some sort of recovery process, then people in the community can put you up for a period of time with some other supports and so on. And around that, the people who put you up can be paid at a reasonable rate, and you get to, you're not at the mercy of some stranger. You can stay within your community. So then the co-op would help organize those services. So this is how I plan to age in place. Pretty nice, eh? Yeah, I'm practicing pointing my toes and so on. Yeah, so this is how, commercialized aging in place looks like, right? This is how seniors see aging in place. So, not institutionalized and cold. I can't afford to move. Safety, comfort, and low maintenance. I do not want to move. I'm with them, right? Yeah, that's aging in place to me. So, yeah, very hot issue. And when I lived in the housing co-op in Edmonton in, well, a few years back, we see 96 to 20 something. Yeah, we'd been talking about aging in place. How can we make that happen? Because people tend to stay in co-ops, especially single women. And Mike Lewis was talking about his housing co-op in Surrey. He said, my girlfriends are now 84 and 96 years old. So, you tend to stay in a housing co-op. How can we make that happen? So that's what this is about. So, College and Elder Care Co-op. Yeah, really interesting, matching members with those that can provide the services. They're also looking to partner with agencies that are already providing services and make it appropriate for seniors. And so really a matchy-matchy. So this allows then people to stay in their homes longer. I know when my mother probably left too soon. She had a few supports, a few helps, and she just found that very uncomfortable to have someone in her home helping out, and while they were eating, what's the person going to do? Is she off? Anyway, so she didn't quite get that worked out. But if a co-op can help make that happen in a way that's appropriate for seniors, then this is a good service. So. Another model in Calgary, so what they're doing is renovating houses, putting the senior, having the seniors stay in their home on the ground floor, renovating it to make it work for them, and then putting younger people on top who have better knees and can climb stairs. So, it's a great thing. It's been going on for quite a long time. I think Avi Freeman was working on that architecturally, 10, 15 years ago. So this is great that someone is doing this and assisting seniors to stay. And then, so the co-op will handle all that property management stuff for the co-op. So. For the members, rather, for the seniors, and set up a kind of a quasi-rental agency, if you like, and do property management around repairs and so on. So this is my daughter, Allie, and so the question really is, what's she going to be asking? What about mom? How can we help mom? And hopefully, with these kinds of models and the kinds of empowerment that a co-op can offer, it'll make it a lot easier for Allie and all her generation to support. I'm really the sandwich, in the middle of the sandwich here. Support her and support me as we move forward in ways that, empowering to both of us. So she's not going to worry, and I have the power of decision making over my own life and won't be treated like a child. So yeah, thank you very much. A little bit of information there if you want to follow up. Thank you.
Thank you very much, Carol.
Yeah.
So again, any quick clarifying questions for Carol?
Just if we're going to get copies. Did you send them to us?
Yes, I did. Yeah, thank you.
The last one you showed the seniors on the bottom level and they renovate
Yeah.
the top. Do they still maintain ownership of the home?
I don't know. That's a very good question. I'll find out for you. Yeah,
Okay.
yeah,
Interesting to see.
yeah.
Okay, thank you, Carol.
Thank you.
Okay, and last but not least, we have Andy Horsnell coming. He's the co-founder of Common Good Solutions, and Andy, you're speaking on social procurement. And how do we connect social enterprise with corporate and government
doing this
buyers?
right?
Okay, Andy, wired up.
Do it this way just so that the mic is on the
Oh,
other
good.
side.
Okay. All right. Okay, so we've all been sitting for close to an hour. Everybody stand up. Stand up. And reach for the sky. And then bend over to your right. And over to your left. And, wave your fingers and shake it a little bit and then sit down. All right. Okay. So, about 4 years ago, I had a presentation all ready to go, and I was going to be presenting here. And the day of the presentation ended up being the day that we were moving into our new house. So I couldn't go, and I got David Upton, who at the time was my friend and is now my business partner, to deliver my presentation for me. So this time round, I'm delivering a presentation on social procurement, which is a heavily edited version of a presentation from my good friend and other business partner, David LePage, out in Vancouver. So I feel in a way I'm kind of getting to return the favor of presenting somebody else's presentation, although I've tried to put my own fingerprints on it. So we're going to talk about social procurement. And just to kind of frame things, just kind of let these numbers sink in. Every year, this is not program funding, this is just money spent on printing and fixing the roof and utilities and stuff just to keep the doors open. $400 billion is spent nationwide by municipal, provincial, and federal governments. Every year, the Nova Scotia government spends $1 billion on goods and services. Not program funding, but just stuff to keep the doors open. The MASH sector, so municipalities, education, social and health services, another $1 billion. The little closer to home, the CBRM, the Cape Breton Regional Municipality, the best number I could get was $36 million on goods and services. And then you look, and that's government, but then you look at all the major corporate. We don't have a huge number of large corporate buyers, but there are a number, and each one of them spend millions every year just to buy what they need to buy. So if we could get just a fraction of that being directed to social enterprises and community-based enterprises and local enterprises, it would have a transformative impact on our communities. Like, so 0.1% nationwide, that's another $400 million going into our sector. And I put the question to Mike Lewis this morning about how do we go to scale, how do we up the pace? Well, I think social procurement, along with social finance, is one of the big levers. You can move a lot of resources and make a lot of change quickly. So we've invested pretty heavily at our firm to get behind supporting that. What I'm going to cover just really quickly, so what it is, why do it, some trends, some barriers, recommendations, and then we'll finish up with just a bit of a pitch on an initiative that we're fronting called Buy Social Canada. A little more context. This is one that's a little nearer and dearer to me. I've been on the board of this organization on and off for several years. The Flower Cart in the Annapolis Valley have an annual $1 million contract with Michelin Tire, and so they have a contract to strip rubber from tires that didn't work out, and sharpening knives, and doing stuff that needs to happen in the plant. And if it didn't happen, the plant would stop. And it employs 40 people who've faced persistent barriers to employment, who are chronically unemployed, full-time, living wage, minimum wage or better. So, pretty great and multi-year arrangement, and it makes a big difference. So, what is social procurement? It's pretty simple. It's about creating social value from existing purchasing. This is not about asking governments and corporations to spend more money than they're already spending. It's asking them to spend even just a little bit of the money they're already spending and directing it towards social enterprise suppliers who are meeting the same basic requirements of their non-social enterprise competitors. So, real simple, demand plus supply, so government purchasing or corporate purchasing. They need a product or service, but they also look at buying some social value along with that. And that's what when we put those three things together, we get social procurement. And just to kind of keep it really real here, I know that a whole bunch of you are doing this as on the supplier side. How many people here are running or have an enterprise, a social enterprise that supplies to government? Quick show of hands. Just a few, yeah? All right. So it's not like a brand new thing. Like, people are doing it. So on the So why would government want to do this? Well, there's a double value proposition for government. It's a very easy, clear one to pitch. On the first level, so hiring a social enterprise versus a regular private enterprise, well, you'll still get the goods and services that you need to run your programs and to keep the office running. But you also, through that purchasing, make a direct investment in enterprises that are directly enacting your mandate. So it's a double win, and it's a pretty easy one to pitch. On the corporate side, same thing, double value proposition. Same thing, they need goods and services like any other, they're gonna buy them anyway. But they get these social value benefits, and there's a number of them. They will enhance their brand and their social license to operate in their communities. So social license just meaning, do we really want, I don't know, Walmart working in our running a business in our community? Well, maybe no, maybe yes. But if they're heavy into social procurement, maybe we feel a little better about Walmart being in our community. It also can have a good impact on employee retention. Employees that feel good about the companies they work for tend to stay. It helps to build a more resilient, diverse supply chain. And it can enhance, those things all together can enhance long-term competitiveness and profitability. So it's if you can package it up right, it's a pretty good deal. So it doesn't have to be either or. It doesn't have to be, well, we do social impact as a nonprofit or we do financial ROI as a private company. You can get both. And so, social enterprise generally is about shared value or blended value, but social procurement specifically is definitely about creating shared value. And my good friend Michael Porter at Harvard, he's on side with this, so I guess we're good with it then. Shared value is creating social and economic opportunities, improving societal problems with the business model. He robbed our definition of social enterprise. So some trends in procurement generally, let's kind of set the table a little bit. Up until about 1970, there were really just three factors that procurement departments looked at. To get the best quality for the lowest price and the lowest risk. And then from 1970 to about 2000, they added in an environmental component. So protect the environment. At least if nothing else, don't do no harm. And then since about 2000, there's increasingly been added a social component. So you get the kind of the triple bottom line here. You get when you add social in, so you get both the social, environmental, and financial. So it's a fairly recent thing. And even within social procurement, we're seeing a progression from on the left side, kind of a do it because we have to, over to the right-hand side to do it because we want to be transformative. Whether as a municipal government or as a private corporation. It's not without its barriers. And so from the government and corporate side, there are a number of barriers and challenges. These folks like big contracts, and just a few of them, because they're easier to administer, and they hope to get economies of scale, so cheaper price. Doesn't play well with most social enterprises who tend to be small operators who can't bid on a huge contract. Their bidding qualifications, they often generally are very risk averse, and this is a new thing and to them, and well, that kind of ups the risk profile for them. There are also some really perceived barriers around, on the government side, around trade agreements. Oh, we can't give preference to a social enterprise because the World Trade Organization or NAFTA or CETA or the interprovincial trade agreements won't allow us to do that, when in fact there are clearly defined financial thresholds within each of those agreements of between $100,000 to $500,000 per contract, and on top of that there are clear loopholes designed for specific kinds of situations and certain kinds of enterprises that can get around the restrictive trade agreements. So they're more, if you're going after a big contract, you still may kick in, but there are from the $100,000 to $500,000 contract size, which is probably well matched to the capability of many social enterprises. It's pretty fair ball. And also, just how do I know who's a social supplier? On the supplier side, so the social enterprises that supply goods and services to corporations and governments, there's an issue around the capacity to meet the increased demand. You can be going from supplying 100 units to a local customer to 10,000 units to the province, and that's a big jump. And how do you make that jump? And alongside with that comes a heightened requirement for business skills, especially around marketing and sales. And I would also say project management and production. And there's, again, on top of that, a challenge of measuring and demonstrating the social impact that the government procurement folks or the corporate procurement folks want to see, because that's the icing on the cake for them. So you better be able to explain that to them. And it can be a challenge sometimes, depending on what kind of enterprise you're in. This is a quote from a corporate purchaser out in BC who said, "When all else is equal," and that's a really important if. When all else is equal, telling your social impact story is essential and parenthetically in there I would say very compelling. And social value suppliers are really terrible at conveying that. So they want to see it. They will give preference if you can meet the same basic requirements as the private sector suppliers, but you got to be able to convey it to them. But that when all else is equal is an important thing. Like they're not going to buy poor quality over and over again just because you're a social enterprise. So you have to meet or exceed those same basic requirements. There are some shared barriers and challenges. Just learning how to play together, and having the policies and the relationships and the practices are different because a large corporate procurement officer is used to dealing with large corporate suppliers. Or at least a handful of suppliers. Shifting from that to social enterprise, and that means shifting mostly to small and medium-sized enterprise. So, and maybe a consortium of small and medium-sized enterprises. Well, how do you do that? That's different than what we've been doing. And measuring success. So what is social impact really, and how can it be measured? In this game, it's not enough to talk about how you use the inputs or even just the head count, the outputs of your program. They're going to want to see at least outcomes, in the short-term outcomes, maybe long-term impact, and maybe they want to monetize, through an SROI approach. That one, I think if we can just get the outcomes, we'll be doing good. So recommendations for corporate and government purchasers. There needs to be, this is an organizational change thing, so the leadership has to come from the top and be put up across the organization. There will be a requirement to change policies and practices, clear implementation steps, and so getting clear in their mind about what are our impact goals, and just getting their heads around what does that even mean. Recommendations for social enterprise suppliers is needing to up your game. Like if you're going to wade into this big pond, you're going up against different kinds of competitors, different scale of contracts, and it's not and we can do it. We're game, but it just means we have to be prepared. Having some kind of certification process can be helpful, and that's where we come with BiSocial. I'll talk briefly about that. Enhance market and customer knowledge, and ensure, not ensure quality, and competitive pricing. So again, just knowing that you got to be, all other things have to be equal before your social value proposition kicks in. And get really good at establishing impact measurement. Overall recommendations in there, we're at the stage right now still trying to get people to talk to each other and learn from each other about what each side needs. So specific recommendations for government. Start thinking about, if you're a government procurement, thinking about what are the big overarching benefits that you want to affect or get through social procurement. Who do you want to buy from? Do you want to, because you could target specific kinds of enterprises, and think about your practices. And there's been some, there's been some good movement within Nova Scotia procurement around this. It's still a work in progress. So, Buy Social Canada, it's about 2 years ago, 2 years ago, David LePage went over to the UK and learned about Buy Social UK, which is a certification program to help make these connections. And he went ahead and got the Canadian franchise for Buy Social Canada, and then we've come in as an equity partner as well. So just all in the interest of transparency, this is part of our business. So this is the what is that? What's that called? The logo, yeah. And the first thing we said when we saw it to our British friends was that looks like a baseball. And they said, what do you mean? They don't, they don't know what a baseball looks like. So we get the baseball logo. So what is Buy Social certification? It's like any other certification. It's like fair trade, or 1% for the planet, or Buy Local. It's a way of communicating to the market that that we're real, and it helps sellers who sell products and services to the benefit communities to connect with more and bigger buyers. So we're about trying to create the marketplace, but also help educate both sides about what you're going to need to do to be able to A, you should do it, and B, how do you have to go about it, and making it clear for who you should be playing with as well. 3 big benefits. First of all, encouraging social value purchasing, providing an external certification, and it's not like this huge ISO 9000 thing. It's pretty straightforward, just to make sure that you are legitimately a social enterprise, that you are legitimately there, using a business model to affect direct change in your community. And because a lot of the corporate folks aren't going to know how to figure that out, so we're going to help them do that, or we are helping them do that. And just providing a space, like an online marketplace where people can come together and find each other. For more information about Buy Social Canada, so we're the Buy Social reps for Atlantic Canada. My colleague Rodney Small, who is Rodney in the room? Rodney's right there. So Rodney's our guy for Buy Social Canada. That's his contact info. A little shameless promotion over to Rodney. Well, I'm never done early. Anybody who knows me knows I run late long. So this is like amazing. So thank you very much.